Cryoablation was just a word that I only just heard when I came here.
I was very shocked at the news as the surgeon suggested a double mastectomy.
I really wasn't keen to do anything drastic at that stage.
It was confirmed that I did have stage 1 breast cancer, which was devastating.
I returned to normal activities almost immediately.
For myself, I'm much stronger. I don't take any medication at all, and I feel a different person.
I'm hopeful that I'm going to be cancer-free.
Now, for a first in South Africa, is the breakthrough of offering cryosurgery cancer ablation in the outpatient scenario of a radiology suite.
Cryoablation is an alternative to surgical excision. In addition, it offers a solution to those patients who are not fit for surgery and have been placed onto long-term endocrine therapy like tamoxifen. This provides an option whereby we will destroy that tumor for them, often shortening the length of time that they have to be on those medications, and also giving the peace of mind to those patients that the tumor has been destroyed.
In July, Dr. Ben asked me if I knew about cryoablation. She told me that Dr. Shub, who is a breast radiologist at the Park Lane Women's Wellness Centre, was doing this procedure in South Africa.
I must say Dr. Ben, bless her, just kept on saying we're going to freeze the spot, which was for me a more likable word to use.
So this treatment has been around for at least 15 years.
This is a well-recognized procedure throughout the world, so it's not fringe medicine, but it's well accepted, well researched on many studies showing unbelievably good outcomes with a less than 2% chance of cancer recurrence.
Freezing of breast cancers really has been developed in Japan in particular, and also in the United States. There have been many trials of this procedure to show how effective it is.
It was not a bad experience at all.
I started off with a mammogram.
I was very calm, and Dr. Shub was wonderful. He explained all the details, and he was operating on my right breast to start out with.
And then that was followed by the ultrasound.
I was wearing earphones, and I'd been asked what kind of music I liked, and I was listening to the most divine classical music.
And his assistants were comforting and supporting me, and one held my hand throughout the whole procedure.
And I just had this feeling that Dr. Shub was being extra careful with me.
I'm excited, it's a challenge, and I'm very blessed that I've had this opportunity offered to me. At the same time, it's a little daunting, but I have all the faith in the people that are going to be doing it, and I'm quite sure the results will be very favourable.
This is an outpatient procedure. We use local anesthetic to numb the area. Once it is numb, we introduce a probe or needle through the skin and into the center of the tumor. We are able to target that very precisely by using ultrasound. In that way, we are able to ensure that we freeze just the tumor. Once the needle is in, liquid nitrogen flows through the needle. It never enters into the tissue itself. It stays within the needle, but it makes the needle extremely cold. And near the tip of the needle, where it's the coldest, ice forms within the cells of the tissue around the needle. That ice forms a spherical ice ball that completely engulfs the tumor, and the ice causes the cells of the tumor to rupture, and it destroys it permanently. Once the probe is in, we cause The freezing, we do that for a period, then we allow it to thaw, then we freeze again, and that cycle permanently destroys tissue. Once we are finished, we remove the probe, we put on a small dressing, and the patient is able to go home within 20 to 30 minutes.
A little bit wobbly when I got off the bed, but now I've recovered completely. At the site where he was working, the feeling's coming back, or the injection's wearing off, and it's a little bit sensitive. But really, I'm very pleased that I had it, and it wasn't an unpleasant experience.
What impressed me the most was that evening Dr. Shub phoned me to find out how I was feeling, and that aftercare treatment meant the world to me.
I can say without a doubt that I'm 89 and never had any doctor phoned me to find out how I was.
Following the procedure, patients might feel a bit bruised for the next couple of days, and if they need anything, usually over-the-counter analgesia is sufficient.
I would fully recommend it to anybody.
Definitely recommend anybody to have this procedure.
I haven't regretted for 1 second that I had the procedure.
It's a minimal invasive procedure, and I'm quite happy to say that I think it was a success.
In my lifetime, I've seen many of my friends, I've seen many of my family, not family, but people that I know who have had that invasive surgery. And it's daunting, it's traumatic.
Anybody who is recommended to have this procedure should have no worries about anything.
This is clean, it's neat, it is so quick.
We have partnered with IceCure, which is an international company. They are very experienced. They have been in this business for over 10 years, and their equipment is used all over the world. TechMed are our local partners. They are a radiology equipment company based in South Africa, and they are the agents for the IceCure cryoablation machines, and they provide local on-site support.
Currently, we are pushing the medical aids to fund it, as I'm a strong believer in we must do what's right for patients and not what's right for doctors.